Welcome to the Piece by Piece Autism Podcast with your hosts, Angie and Christy. They've worked 25 years to help Alec get the most out of life. Let them tell you how they're doing it.
Welcome back to Piece by Piece Autism Podcast. We're glad you are here. Christy and I talk all about our years of experience with her youngest son, Alec. Alec has severe autism, is nonverbal, and lives in Utah in a group home setting. He's a pretty cool 28-year-old guy. He continues to grow and exceed our expectations every day. He is living his absolute best life, and we are here to share with you what we have learned along the way. I'm going to let Christy introduce our guest for today's episode, and the topic of today's episode is special needs dentistry. So take it away, Christy.
We're super pumped to have Meet and Abby Patel. Meet is a dentist and Abby is a dental hygienist, and they work together in an office now, and they worked together when they first met in an office where she was a dental assistant and he was a special needs dentist. Abby is my niece, did I say that? And she's younger than Alec, but she actually helped potty train Alec, among other things. She also did some table work with him and was really, really helpful and kind of being his peer for peer training along his developmental years. And that was so cool to have them be side by side and be buddies and have her be a great teacher to him. They introduced Alec and our family to the Indian wedding. And if you saw on our Instagram, we've got adorable pictures of Alec joining in the Garba. Is that what it's called?
That's
right. That's right.
Yes, it was so fun to watch him do that. So we welcome y'all to the show, and now I'm going to let y'all give a little intro if I left any stone unturned.
Thank you. First, we want to thank Christy and Angie for welcoming us on this podcast, especially about the topic today, which is something we're very familiar with. And like Christy said, my name is Abby. I am a dental hygienist, and I have been in this field for almost 7 years now. And a little bit of a backstory about Alec, because this is what this podcast is about. We were able to spend a lot of the years together, and I was able to watch him grow up. And it was pretty cool to see how much he grew every single time I was able to come to Dallas and hang out with him. And I really loved going on all the outings with him and all of his teachers, especially Angie. She was the best teacher. She still is.
Still is.
Still is. And I look at Alec now to see where he is, and I'm like, Alec is living his best life, and sometimes I'm kind of jealous of his life because I see all of the social media things, and I feel like he has turned into a really good and special young man. And then that brings me into, having all of the experience back in my childhood years with special needs, and it has definitely shaped who I am today in my field that I work in, because I got a lot of experience working at the dental office with special needs. And I now have a sister-in-law who has special needs, so I have had plenty of experience, and that is also how I met my husband at the special needs dentist, and I will let him take it away now.
Hi, my name is Meet Patel. I'm a general dentist here in Lubbock, Texas. I got my undergrad degree at Texas Tech University, graduated in 2014, and after 2014, my ambition was to become a general dentist, so I moved out to San Antonio, Texas, where I trained for 4 years to earn my doctorate, my DDS, and got my general dentist license to practice as a dentist. And I straight to Lubbock, Texas, which is really my hometown. Although my growing up part was in Mumbai, so I was born and raised in India. My parents and I moved to Lubbock, Texas, straight from Mumbai when I was 10 years of age, and this is more of a memory of my childhood when my dad, I think I was 12 or maybe 13, and I was sitting in the back of our car, and he asked me like, "Hey, son, like what is your um, what is your goal in life? You know, like what do you aspire to become?" And at that age, I mean, it's, when someone's asking you that question, it's really, you don't even think much, you're not really serious about,
Mm-hmm.
what you want to do with your life. Most kids at that age would say, "Oh, I want to be like Michael Jordan. I want to be,
Yeah.
something like a character or something of that nature." Um, but I specifically, and this is, true memory, true words. I just told him that, "Dad, I want to be a dentist." And I didn't even think about it. It was, my own fresh words that came out of my mouth. And they, both my dad and my mom, who were, sitting in front of the car, they turned around and they looked at me like, "What?" Um, and yeah, like they were kind of puzzled, like, "That's not true." Like, yeah, yeah, it is. And then, some, time passed, and the reason why, first of all, I said those words because of my sister. My sister is she's special needs. She say mild to moderate autism. Her name is Arpita Patel, um, and she's been a big, large influence of my life, and one of the main core factors why I made the decisions that I made in my life. And because she is special needs, and this is, gosh, about 20 plus years ago, when she was going to one of our general tenants here in town. He goes by the name of Dr. Gregory, and he was actually the officiator at a wedding last year.
Oh,
Um,
wow.
so yes,
Yeah.
yes. So going to his clinic, and this, I'm like 10 years old, and seeing my sister in the dental chair. I think that picture, that just a visualization, of me as a kid, like seeing my sister being operated on, that kind of instilled this vision in my head. Like, okay, I see myself doing that.
Yeah.
And again, I'm so young, like that. I'm not sure, that people, kids even think about something like that, you know, a career choice at that age.
Yeah.
So that's what really led me to say those words to my parents when my dad asked me that question, like, "Hey, what do you want to do with your life?" And I said, "Yeah, I want to be a dentist." An opportunity came up at Happy Dentistry, um, where when they interviewed me, they asked me like, what are you, what do you like, what you don't like, and uh, during the interview, I mentioned, of course, I want to be a general dentist. I want to work 5 days a week, XYZ, um, and I'd mentioned a little bit about my family, including my sister, and I think that's when this opportunity kind of came up to me, like, "Hey, we have a practice that we're about to buy a practice that specializes in providing care to special needs patients here in Lubbock and surrounding counties and states. Would you be interested?" And for a second, I was like, uh, you know, "I'm not strictly like trained in special needs dentistry, but I can learn. I can learn." And I did. I took the opportunity, and it became something that I was, known for a good almost 7 years.
That's
You know,
Oh.
awesome.
Is there a special training for special needs dentistry?
during my time in dental school from 2015 to 2019, there wasn't a program that was just specifically for
Mm-hmm.
getting training certification, excuse me, in special needs dentistry. There were, however, other like small residencies where
Mm-hmm.
you can travel, certain counties, state, whatever, and get that certification. But most dental schools, they talk about it. So I will say that during the lectures or topics, they do mention it. But as far as getting hands-on training, actually seeing special needs patients in the clinic, that was something that I did not uh, receive. Uh, so it's something that I kind of learned as I got the job opportunity.
Yeah.
And A lot of it was, you know, self-learn. I learned a little bit from other doctors, friends. Lately, I have heard that, a lot of schools are getting advanced with their curriculum, where they're they are providing some amount of special needs dentistry training to individuals who want to pursue that path.
And obviously
But
you come with experience, you know.
and
So
that
in
definitely,
some ways I would think a sibling of someone who has cared for someone as
mhm,
I'm sure
yes,
intently as you have with your your sister.
yes, and I think that really, that's what made my decision, you know, made it not so hard,
Right.
made it simple. Where, um, of course, I gave it a little bit of thought, and then finally said yes, I'm definitely up for it. Um, but yes, having that experience of taking care of a sibling, an older sibling, I can definitely do it, and I want to get better at it. The special needs, that's such a large, uh, there's so much to it. It's not just individuals who have autism. It's
Mm-hmm.
individuals with Down syndrome, cerebral palsy. There's so many, even with just having a medically compromised condition,
Mm-hmm.
that you're in that realm of, that special needs where you just need extra care, attention, focus.
What can you tell us about the similarities or the differences among the different special needs patients who you might see in the course of a practice? Like how are a lot of autistic patients very similar or
Um, I would say in my experience at that office with the special needs patients, there was a lot of differences in each of them. Some of them, they were very calm. Some of them were very, they love to laugh. They would make jokes with you. Some were extremely scared. And I don't think it mattered on which like disability they had. It was just what was going on in the chair or the mood that day they were having.
Mm-hmm.
And I think the caregivers that bring the patients has an effect on them as well. I noticed that practice at that any patients that who walked through the door, most of them did not have parents with them. They were mainly all caregivers that work at the different schools here in Lubbock.
mm, interesting.
That is interesting.
As a dentist, when, you know, this is just in general, when a patient comes in, we go over their medical history, their overall, experience with dentistry, or just their whole social history.
Mm-hmm.
And, you know, most patients in general practice are able to answer majority of those questions. But in a setting where you're seeing patients who don't necessarily understand, um, their medical history, you want some to be there, um, to help answer at least those, pre-operatory, pre-treatment questions that helps dentists, assistants, just the overall staff, understand the patient better before providing that treatment. So
Mm-hmm.
a lot of times I would end up calling their group phones, talk to, um, the nurse on board, or even, sometimes if they don't know the answer to a question, then we have to speak with their, family doctor. And sometimes we're lucky to get a hold of them, straight in the office, and sometimes we have to wait a day or two to get their response. And it gets a little bit tricky when there's not like a parent,
Yeah.
or like a sibling, or someone who's lived with them, someone who grew up with them, who understands their medical history.
Yeah. So, what would you guys say some things are that you guys would do or that you consider kind of tricks of the trade, right? You've done this for many years. You've seen, I'm sure, like you were saying, Abby, everything from good mood to bad mood and in between. But what would you guys do to make that a successful visit as much as you could on your end, right?
I feel like at that time when I was an assistant, you're the assistant is who is with the patient the most because you're bringing the patient back, you're sitting them in the chair, you're taking their x-rays, you're getting them ready for the doctor. So the assistant really has to know what to do in those tricky
Yeah.
situations. And I've seen some situations where maybe the patient needs a certain bag of food to bring with them just to help them be more calm, or we give them something to hold on to. And like I know, like in Alex's incident, he loved like I'm pretty sure he still loves
Loves
to
them.
hang on to the beads.
Oh, yeah.
So yeah, so things like that, like even having them hold like little stuffed animals, or letting them listen to music or watch an iPad. Honestly, we would think of so many different ways to get really good x-rays, because when when you're in a dental office and the dentist is trying to do a thorough exam, it's very important to try to get the best x-rays, just so giving the best care and knowing exactly what that patient needs.
Awesome.
Yeah, we've always used counting with Alec. We have conditioned that from the time he was really young. So counting is one of the things we used.
Yeah.
Did y'all ever see
Oh
anybody
wow,
else
okay.
use that kind of method? And we conditioned it so that when we do count, he understands there's a beginning and there's an end. It's very clear, it's very plain to see for him. It just makes it where, okay, I'm going to tolerate this for this period of time. And that's how he's helped him in dental visits, although
Yeah,
dental
right.
visits have been one of his biggest,
Yeah,
you
they've
know,
been a struggle.
they've been a struggle. Yeah.
And I think
So,
they're a struggle. I mean, I think it's fair to say not everybody loves going to the dentist. I think it's a struggle for a lot of typical
We never
developed
I don't like
people.
going.
So,
I
you
don't like
know,
going. Do you
kids.
like going, Meet?
we've
I
never
will. I
heard that sentence before.
no. I
So,
will say it is a.
It's a
You know,
scary place.
it, it can be, yes. And I think it's funny that you know, in general, when people have something going on, they'll go to a medical doctor, get a shot or get a flu shot or something. But when it comes to dentistry, um, mouth is one of those things that can be so sensitive,
yeah.
Yeah. Right.
and I understand, like, like my mom came in today to see me, and I can immediately sense
Yeah.
the
Tension.
level of anxiety, the tension,
Yeah.
like, okay, especially in dentistry, it's obviously a little bit more like a level or two up where you have to
Oh, yeah.
sort of, you know, what I do is just kind of talk to them first,
Yeah.
rather than picking up my instrument XYZ, all right, let's
Yes.
take a look, jump right in. Um, I want to talk to them. So, while my assistant is taking the blood pressure, just, gathering the paperwork up, I just talk to the patient. I talk about what I'm going to do with the procedure in kind of layman terms used with all the terminologies that we throw around in dentistry, but just so they understand, like, yeah, like, we're going to clean your tooth up, and you'll be on your way, rather than going into like all the details, and then
Yeah.
Yeah.
they get scared, and like, so I try to do my best to make it as easy as possible. Obviously you want to work kind of quickly through it, but I would say eight out of 10 times it works. It's in cases where when someone has just extremely extreme anxiety, high level anxiety, where they're kind of shaking, they refuse to open their mouth. um, the sight of the dental needle, just, like, you see, smoke coming out of their pupil. So,
I get
like,
nervous just hearing about it.
Yeah. Are there ways that parents or caretakers can better prepare for these dental visits? Do you guys have any suggestions or recommendations on what we as the caretaker and parents can do?
I would say, from my experience, just seeing how the patients act, and especially when they're coming to the dentist maybe for the first time, bringing things that you know that they enjoy, like we talked about, like
Mm-hmm.
beads or, stuffed animal, something that they can hold on to. And then also, like we said, a lot of these patients, they come with caregivers or drivers, but knowing more about the patient before they come in because sometimes when they come in and the caregiver or the driver, they can't give us very much information
Right.
about who we're seeing. So, really just knowing the patient's medical history or their background or having someone with them that, can give us more information, because sometimes if we're doing, sedation with the patients, we're taking them to the hospital to get treatment, then it's really for us to know all of the medical history and the background on the patient.
Yeah, for
Yeah.
sure. And also, kind of along those same lines, do you guys recommend a different dental care plan or schedule for individuals with autism or individuals with special needs? I know for Alec, we would do visits maybe more frequently to practice the skill, and he would get maybe a quadrant of his mouth cleaned really well one
Mhm.
time because that's as long as he could tolerate it. But we would come more frequently.
I definitely agree to that, and that's something that we practiced frequently
Yeah,
at special needs, where we will recommend more frequent visits rather than doing your typical twice a year
right.
for a routine cleaning. As I recall, many of my patients came in definitely at 3, 4 times a year,
Awesome.
depending on their schedule, because many of them live in group homes. They have
Mm-hmm.
other things on their schedules throughout the year. So definitely having more higher frequency of visits helped and helps, and just encouraging supervised um, toothbrushing at home
Yeah.
is is definitely very important. Just because having those an extra set of eyes, and the person standing next to you, and they're just telling you, okay, you need to do this, this, and this, kind of show them, demonstration, just visualization
Yeah.
can help in many
For
ways.
sure.
Do special needs patients sometimes have better dental hygiene than your typical patient? Like our patient, our guy, we always have someone, a caretaker with them. So he's always getting help with his toothbrushing. So he doesn't tend to get a lot of cavities, knock on wood. And he tends to have a pretty good dental report when he
Yeah.
goes. But we're going over his teeth after he brushes them with a electric toothbrush. We have the little flossers. What do y'all find? Is it kind of
I
a
would
mixed bag
say
or what?
that's what I wanted to say. Like the patients I remember seeing at that office, I would I would honestly kind of be sad just to, especially when I would see them for the first time, because it's like, wow, is anyone helping them at their group home, or
Mm.
is anyone, giving
Oh,
them any assistance, or it was very sad to see in a lot of the patients, because I would and you try to tell the caregiver, they really need to be getting help with their brushing
Yeah.
or their flossing, but when they leave, I'm not sure if the caregiver would even relay that to the other staff members, because like I said, a lot of the patients I remember seeing, they would always come with the staff of the group home, and some of them didn't even know they didn't know much about them, and so communication I don't think was very good. And so I would say really having that extra set of eyes and the supervision is very important.
Yeah.
So
oh, okay. That makes me kind of sad then.
Yeah.
I know I'm like hearing y'all say how much y'all do with Alec. That's amazing, because a lot of experience I've had, I've not seen that, I guess I would say.
Well, I think there's something to be said for independence,
Oh
and
yeah,
self
Yeah.
for
care.
sure.
Yeah.
Of course, but then there's also something to be said for we really need to maintain these teeth because they're the only ones you have. And,
Yep.
you know, he was fortunate that he didn't have too many like issues in his mouth. He has a little bit of a tooth that's out of order, it doesn't really bite
Yeah.
perfectly. But that brings us to our next question though. Like, what do you do when your patients have like a significant bite problem? Luckily, Alec doesn't have that problem where he would have to get braces. We would have gotten him braces if he had been a typical guy, but they just told me, dentists have always said, oh, he would never survive braces. That would
Oh
be
gosh,
very
that sounds
difficult
awful.
with him. So what do y'all do if a person has a significant bite issue and you really need to address it?
It's case by case. There are some high functioning special needs that I've seen have traditional orthodontic wire braces, brackets where they do great.
Really?
Um,
Okay.
they do great as long as they're following their routine hygiene practice at home to just keep everything as clean as possible. Um, but then there is a population that unfortunately they're dealing with that sort of treatment, and it is a long-term treatment too. It's not just like getting a filling or something done in a 30
Yeah.
40 minutes and you're out of the chair. They have to deal with it at home,
Yes.
when an individual
Ongoing.
has wires and braces, which my wife, she had braces, as a kid. So
For only like 4.5 years.
yes, so she can kind of speak to you a little bit about the difficulties with hygiene. But now you have a special needs patient, and now you can just imagine the difficulties they would have to face.
Yes.
It's already tricky and kind of challenging to enforce a thorough hygiene habit without braces.
Yeah.
I imagine when you do have braces, and that's why
Yeah.
I feel like a lot of dentists generally have that stand where they're not against it. No one's against it, but doing it is one thing, but carrying it out and completing it and maintaining it for life, that's another thing.
Yeah.
So that's why if patients have a good foundation of dental hygiene practice and they've shown it during their visits, multiple times, then I would say okay. And if they have a good tolerability, then sure, go ahead.
Yeah.
You can do that treatment if that's something that is recommended or if that's medically necessary.
Hmm.
Um, but like I said, it's case by case. And the other thing I want to mention is nowadays it's they have clear aligners out where
Mm-hmm.
you don't necessarily have to have the traditional set of braces.
Yeah.
You
Yeah.
know,
Like
um,
Invisalign, you mean?
Invisalign,
Yes.
Okay.
that's basically, yeah, just like clear aligners. So that kind of makes it a little bit doable,
Okay.
I would say. Of course, there are challenges with that too, but I think it's a little bit easier to deal with from a patient's standpoint.
I could see
So
Alec just grabbing his and throwing it.
Throwing it
Yeah.
away.
that's the other thing, like, are you going to keep it in
Can you
your
loop
mouth or are you
it?
going to
Yeah.
just
Oh, yeah.
trash it?
Like when he
So
broke his foot, it was like the worst torture known to man. I
Yeah,
was
that
like,
was
oh
rough.
man, these medical issues are so,
They're so
so
tricky
hard.
for sure.
What do you consider the biggest challenges that the special needs population faces in regards to dental health? Is it finding a dentist who will see you?
Yeah, I would say I think that is the biggest challenge with treating special needs for dentistry. The limited access to dental offices that are specifically tailored to special needs,
Yeah.
because the office that we worked at, that is the only office. I I may be wrong, but I think it's over like a 250-mile radius that is like
Wow.
specifically tailored, because I think the next one would be, Fort Worth, Dallas area.
Yeah.
Mm.
So, and of course there are offices here in Lubbock that will, or in surrounding areas that will see special needs, but I think it's very limited on what they can do and what they will provide. So, for sure, the access to dental providers would be the biggest challenge, in my opinion.
Yeah.
it's always been a thing here, uh, because we're not a big city like Dallas or Houston.
Yeah.
We have thousands of doctors, and few of them, happen to be specialists who provide that care. Here, it's special Abbeville Special Needs has it's the only one, to my knowledge, that is specifically tailored for special needs. Now, any general dentist can treat special needs patient. Don't
Yeah.
get me wrong.
Yeah.
There's there's not a rule like that. Oh, you can't do this.
Yeah.
Yes, you do want comfort, that little bit of training, a little bit of background.
Yeah.
Um, and if and this is my opinion, like if your heart says like yes, you can do it, you can provide the care, um, then I think it's definitely doable, because it's hard enough to find a doctor to provide care,
Mm-hmm.
you know.
Did it make you feel warm and fuzzy that you were providing this service? Like, was it very rewarding for you to say, to go to bed at night and say, I've helped the special needs community have their teeth taken care of?
Absolutely.
Yeah.
Um, it's always been rewarding, you
Yeah.
know, and especially talking about my sister Arpita in the subject, it kind of gives me goosebumps, gets me a
Yeah.
little bit emotional. Like I didn't know that I was gonna be given this opportunity um, to provide care, not just to her, but the entire special needs population. And as Abby said that, you know, within 250 plus mile range, like we're the only ones who do this,
Yeah.
you know. So it is something about it is very remarkable, special, and parents appreciate it.
Oh, I'm
Oh,
sure.
yes.
I've worked at many offices within the corporation, kids office, special needs office, adult office, everything. And I will say special needs was my number one office that I worked at. It was my,
You mean you liked it the
Your
most, or?
favorite?
yes, like it was my favorite office.
We
Yeah.
made it fun. We made it
That's
fun
so
to work
nice.
there.
That's such a
Yeah.
positive thing for your patient and for the patient's parents or caregivers
Yeah.
Oh,
to make
yeah.
it be a positive place. Did
That's
y'all
great.
ever get bit or have any great
Absolutely.
stories from like
Surely you
having
got bit.
come on, did you
Oh,
get
yeah.
bit? I know Alec
Especially
would
me.
bite.
Yeah.
Definitely.
If he got a chance, he would definitely,
Well, especially with the x-rays, because sometimes if we couldn't, fit the big old sensor in their mouth for them to bite on, we would just stick our hand in their mouth to get the best x-ray. It probably wasn't the safest thing, but it's like
No.
whatever we need to do to get the x-ray. But yeah, getting bit was definitely a normal there.
Yes.
Definitely have gotten bit a few times in my growing career. So luckily, I still have all my digits. So
That's very
uh,
important when you're a dentist.
Yeah,
that
very
is
And
good.
a
very important to them.
hygienist too,
Yeah, we need those.
Yeah, like
We
we
need
definitely
those.
We
we
do
cannot
not
go out.
we do not want to go without mentioning again the wonderful practice that y'all have started together. They're such a cute couple. They just got back from Greece from their honeymoon. It just looked like the most wonderful trip.
So cool.
It was the
And
best trip
they
ever.
have their own practice called Meet Your Smiles in Lubbock, Texas.
Which is
And
the cutest name.
I should have the address memorized because I just mailed you a bunch of stuff. But I don't. What is your address? Where are you located in Lubbock? South part of Lubbock?
We're located, yes, in South Lubbock off 117th and Frankfurt Avenue.
Okay. So look them up. Meet, that's MEET, Your Smiles. Smile? Smiles?
Smiles.
Plural.
Plural, meet
With
your
an S.
smiles.
Plural.
We treat lots of smiles.
Yes, we
So
do.
make
Every day.
sure that if you're in Lubbock that you they don't do they are not in special needs practice anymore, but they are in private practice now. And so if you are in Lubbock and you are in need of some dentistry, please go by. And also maybe y'all could help somebody get connected with a special
Yes,
needs dentist.
Yes,
for sure.
definitely,
They have a good
definitely.
network there and know who's doing the special
Yeah.
needs stuff.
No, definitely. Having that background, it definitely helps. So,
Yeah.
um, as you mentioned, like my practice obviously we're not fully 100% tailored to special needs, but having the background that I received, we we were open to providing the care,
Mm-hmm.
you know.
Yeah.
So it just opens more doors for parents, for families.
Yeah.
to have that another access. So
Right.
um, obviously we're not the same exactly where we provide hospital dentistry and sedation dentistry like the previous practice does, but at least to a smaller extent, if we can provide something at the chair side, then we're always there.
Did you mostly do sedation dentistry in your office? That's one question that I meant to ask that I didn't. Or do you prefer to
I
do it in the hospital?
so I sort of have like a love-hate relationship with sedation.
Yes.
Just because the nature of sedation itself. I mean, there's minimal sedation, moderate sedation, then you have hospital level, uh, sedation.
Yeah.
So at Abbeville Special Needs Dentistry, we had a board certified anesthesiologist who would come every,
I think like twice a month.
was it twice a month? Maybe twice a month. But anyways, he came. He's actually based out there in Dallas, but he would come to Lubbock and provide 2 days of or X amount of days of care, where he would provide moderate sedation to a lot of our special needs clients. Myself or uh, the senior doctor that I worked with, we would provide our basic level of care, um, and and this is really more for people who had that what I was talking about previously, the moderate to high level of
Yeah.
anxiety, where nitrous oxide sedation is not
Yeah.
enough, or
Yeah.
minimal sedation, which is something I'm certified with, is not enough either. So that's when having that IV sedation or hospital level sedation really helps.
So the
So
moderate is where you're just putting that little mask on and breathing in and breathing some laughing gas. What is what we used to call it?
that's more like minimal, mild level
Okay.
of sedation, just to kind of take the edge away. Basically,
Mm-hmm.
helps you relax.
Yeah.
It doesn't work well if you're just naturally just have this bad phobia, fear of dentistry. Um, it works to an extent.
Yeah.
From my experience, having IV sedation, and again, this is all when it's medically safe to do so.
Right.
Making sure the medical history is fully taken into consideration prior to making these decisions. But yes, that this is when IV sedation helps, and in many cases where you have extensive amount of dental work, then hospital dentistry is definitely also another safe route
Yeah.
to take.
Okay.
So yeah.
Good. That's
Very
great.
good.
So glad to hear that.
Well, it sounds
'Cause
like you guys have had lots of experience, lots of stories, I'm sure, that
Oh, plenty of
we could
stories.
share.
Yes.
But thank you for dedicating years and time to this population. I know it's not the easiest always, but definitely a well-served and well-deserving group of people.
Definitely rewarding.
So, well, thanks so much for
Definitely.
joining us. We so appreciate your time tonight.
you.
Thank you.
And that's a wrap for today's episode of Piece by Piece. If you're loving these conversations as much as we are, hit the follow button, share the show, and help us spread the word, because every piece of the story matters. You can find us on Instagram and Facebook at Piece by Piece Autism Podcast. That's PIECE, Piece by Piece Autism Podcast. We'll talk to you next time. Bye.
Bye.